Hey mental health warriors. So, have you ever cared for a patient who seemed euphoric and energized one day, then withdrawn and despondent the next? You could be looking at bipolar disorder, a chronic psychiatric condition marked by extreme mood swings that impact function, relationships, and safety. Today we'll break down what it is, what causes it, how it's treated, and how nurses can help stabilize both minds and lives. Bipolar disorder is a mood disorder characterized by alternating episodes of mania or hypomania and depression. Now let's talk about what a manic episode looks like. During a manic episode, you'll notice an elevated, expansive, or irritable mood, increased energy, grandiosity, and a decreased need for sleep. Folks might also engage in impulsive or risky behavior, and in some cases there can be psychosis, like delusions or hallucinations. Next, there's the hypomanic episode. This is similar to mania but less severe. There's no psychosis or major functional impairment, but it can still be pretty disruptive to relationships or routines. And then there's the depressive episode. Here we see sadness, hopelessness, and fatigue, along with a loss of interest or pleasure in activities. There might be changes in sleep and appetite, and in severe cases, suicidal thoughts can occur. Types of bipolar disorder include bipolar 1, which involves at least one manic episode, with or without depression. Bipolar 2, which includes at least one hypomanic episode and one major depressive episode. And cyclothymia, which is marked by chronic, less intense mood fluctuations. So what causes bipolar disorder? Well, it's a mix of genetics and brain chemistry. There's a strong genetic link with first-degree relatives at higher risk. Plus there's dysregulation of neurotransmitters, especially dopamine, serotonin, and norepinephrine. There are also structural and functional changes in areas of the brain that regulate emotion and impulse control, like the prefrontal cortex and amygdala. When it comes to treatment and medication, mood stabilizers are the mainstay. Lithium is the gold standard here, but valproic acid, carbamazepine, and lamotrigine are also used. Atypical antipsychotics like olanzapine, quetiapine, and risperidone are often used in acute mania or mixed episodes. Antidepressants can be used but very cautiously because there's a risk of triggering mania. Medication adherence is absolutely critical. Inconsistent use can lead to relapse, hospitalization, or even self-harm risk. So, when it comes to nursing priorities in bipolar disorder, there are a few key things to keep in mind. First, it's really important to monitor mood fluctuations. That means using mood charts or scales like the Young Mania Rating Scale, and keeping an eye out for rapid cycling or mixed episodes. Next, managing acute episodes is crucial. During mania, you'll want to reduce stimulation, set firm boundaries, and above all, ensure patient safety. When a patient is experiencing depression, assess for suicidal ideation, and encourage them to stay engaged. Promoting good sleep hygiene is another priority, so help patients stick to a structured routine and sleep schedule, and try to avoid stimulants and screen time at night. Education on relapse prevention is also vital. Teach patients to recognize the early signs of mania or depression, stress the importance of medication compliance, and talk through managing triggers like stress, sleep disruption, or substance use. And finally, don't forget to involve the family. Teach them to spot signs of decompensation and encourage open communication and support planning. The bottom line is, mood swings need steady hands. Bipolar disorder isn't just about highs and lows, it's a daily balancing act that really requires medication, monitoring, and, honestly, a lot of compassion. Nurses play a key role in helping patients find that balance and, just as importantly, hold on to it. So, what's your top nursing tip for managing patients with mood disorders? Let's talk in the comments. And don't forget to like, subscribe, and follow for more mental health care insights, because stability starts with understanding.